Hello, I'm Bill Patten. I'm the interim CEO here at Sept County Health. We had a board meeting on September 24th, and it will be my practice to do a video like this after every board meeting. The goal being to make sure the community knows what our organization is doing and what we're planning for the future. It's important that you be up to date about your hospital. So today's report, as I say, is from the September 24th meeting. As the board typically does, it had an education session before starting the official meeting. Dr. Berger, our lead hospitalist from the medical group Apogee, presented the education to the board. And it was a combination of an introduction into who Dr. Berger was, as well as what is hospitalist medicine all about. Board was very appreciative. Dr. Berger did a great job. The board then called the meeting to order shortly after 6 o'clock and did some of the normal business, setting the agenda, approving minutes. The board asked for public comments. There were none. And then they heard from two different committees, the building committee and the Sublette County Health Foundation. So the foundation that was integral in the building and funding of this new facility that we're so proud of. We had the grand opening, the ribbon cutting for the event, for the facility yesterday. Just a marvelous event. Our governor was there, Senator Barrasso, Representative Hageman, and then representatives from USDA, as well as other officials from the state government. The board was highlighted. Ms. Tanya Hoffman, our board chairperson, was the MC for the event. We couldn't have asked for better weather. Whoever ordered the weather, we need to keep that person on staff. They've got a great connection. But wonderful event. Employees were excited about this official kickoff of the new facility. The board then heard a number of reports. Lindsay Bond gave an operations report, and she spent most of her time reviewing the contribution of individual directors and the roles that they played in helping bring this project to life. Dr. Burnett gave a report regarding the medical staff. Lane Harrington gave a report from a nursing perspective. Don Walker gave a report from the skilled nursing, what will soon be the Heritage Home perspective. And while I'm there, it's important that the community know that our move here to our new facility has been delayed somewhat. I'm sure you've heard, but we have a COVID issue in our community, and we certainly have it in our skilled nursing facility. We're going to wait until our residents are feeling a little bit better before we ask them to make the hike up the hill and move into their new homes. So as soon as we know the date, we will be announcing that to the community. We also had an update from Dominic Symes. He is our representative from our management company, Health Tech. And he covered a variety of topics, and they actually set a new education session that the board wants for a future meeting, the board's role in credentialing and privileging the medical staff. The board received a finance report of our August finances. Because we don't have a CFO right now, I lead that report. It's important that the community know that finances is something that is a real concern for us now. It's a three-step process that you go through. Step one is getting a license from the state. And so that has been accomplished and allowed us to open on August the 4th. Step two is getting properly registered with the Centers for Medicare and Medicaid Services so that you can bill for those services. You can't do that until you are officially inspected and accredited. We completed that on September 16th. So between August 4th and September 16th, we're not going to be able to bill for any of the Medicare or Medicaid patients that we actually saw and took care of. It's a 6 to 8 week process to get that certification from CMS. So we're waiting for that. I think it's probably around 5 to 6 weeks now until we should have that. And then we will go back and we'll be able to bill back to September 16th. But we have to watch our cash flow very carefully between now and then. The third step of the process, So step 1 is the licensure, step 2 is CMS certification registration, step 3 is conversion to critical access status. Critical access is a designation that the federal government put in place back in 97, 98, something in that time frame. And it allows small rural hospitals to be paid differently than larger, what are called prospective payment system hospitals. So we need that so that we can have enhanced reimbursement. And it's based on our cost, not a fee schedule. We can't even apply for that until we get that CMS number. So it's this series of dominoes that we have to work through, but we're watching very carefully what our numbers are. In the month of August, a variety of factors, we lost just over $600,000. That is a lot of money, but it is less than what had been done over the last fiscal year. So I'll continue to report until we get a CFO. Once we get a CFO, then you'll see little videos from that person giving a more detailed update on our finances, if not every month, then at least once a quarter. A couple of other things that the board did before I get into my report. They approved normal payroll and bills, and then the board currently has a process where they review every invoice that's over $20,000. So they went through a number of invoices, and then they began a conversation related to reviewing what's called the delegation of authority. In a hospital, it's really important to know who has the authority to do what. So if, for example, we wanted to sell a piece of property that we had, and I'm not meaning to telegraph that we're trying to sell something, I'm just using an example. That's something that only the board can do. It's something the CEO doesn't have the authority to do. I might be involved in signing some of the paperwork, but the board is the one who actually has the authority to approve a transaction of that type. And so the board is being very diligent in going through. We went through the first 5 topics on the list. We assigned the next 5 for the October board meeting. I thought it was a very productive and very proactive conversation on the part of the board. And then under new business, the board took up credentialing recommendations from the medical staff. The medical staff has a 2-step process. They have a credentialing committee that does a detailed review of any physician, physician assistant, nurse practitioner that wants to be part of our team. They look at their training, their education, their experience. So the medical staff is a very thorough process. The board then reviews the recommendations from the medical staff, and only they have the authority to grant the credentials and privileges. So the board reviewed the recommendations from the medical staff. We had a brief conversation about the Rural Health Transformation Program. If you haven't heard of that, that's monies that are going to be coming to states as part of what Washington, D.C. called the One Big Beautiful Bill. It looks like for Wyoming, it may be as much as $500 million over a 5-year period. So we want to make sure that we are at the table. We're going to be scheduling a healthcare community brainstorming session. We don't have a long timeline, so we're going to be looking for that next week. Look for additional information from us on that. But we want to get everyone's ideas on how we can responsibly use that money. I'll be doing a presentation giving an outline of the program as we currently understand it, and then we'll be working on specific projects that we will suggest to the state should be part of that request to the federal government. And then finally, the board had a FOIA request, Freedom of Information request, that they briefly discussed. And they went into executive session to talk legally protected matters, things such as personnel, legal issues, property issues. So the board had an extensive executive session. I had a lot of topics I needed to talk about being new. So the meeting started just after 6 and we ended just before 11. I want to go back and touch on a number of the topics that I covered in my report. So I use what I call the stoplight report process with the board. It helps them to know what I'm working on and when I need them to be involved. So red light means I'm not moving on it until I get permission from them. Yellow light means I'm working on a topic but not ready to make a recommendation. or ask for their approval. Green light means this is something I'm moving forward on unless they tell me otherwise. And then as you'll see in these reports, I typically break them down into the following sections. I start with employees, I move on to medical staff, I talk about financial issues, I have a miscellaneous catch-all, and then the topics I need to talk with the board in executive session. So let's start with the employees. We're looking at a number of policies, specifically the on-call and the callback policy. As I've gotten to know some of these policies, there are areas where I have concerns, and so that's a yellow topic. We're going to be doing work as an administrative team and then making a recommendation back to the board to change those policies. Also, I wanted to note to the board that I've learned that our benefits package is very generous. And from an employee perspective, that's a good thing. From an organizational perspective, I just wanted to make sure that the board understands that that comes at a cost. And at a time when we are really focusing on the numbers on our bottom line, I wanted to make sure that the board understood the impact that a generous benefit package has on our bottom line. We're going to be renewing our healthcare insurance, and I discussed a number of changes that we're going to be proposing to the board. One of them is we want to incent our employees to keep their care local. Now that we have a hospital and emergency department, now that we can do things such as MRIs and mammograms, we want to make sure that people keep their care here local. And so for our employees, we want to make it financially beneficial to them. So it's cheaper, just to say it bluntly, it's cheaper for them to get their care here than to go to Jackson or to Rock Springs. We're looking at our foundation executive director. Now that the big project is done, she is looking at a different model that she wants for her position. We'll be talking about that. It's my understanding that the board currently reviews job descriptions. I'm going to dig into that, and it's my current thinking that at the October meeting, I'll be making a recommendation to the board that they review only a handful of job descriptions. Mine, the CFO's, the chief medical officer, and the compliance officer are the ones that I'm used to seeing. But I wanted to give them a heads up, so that was a topic that was a yellow. And then another yellow topic, but something that I have teed up for October, is I want to do an employee referral bonus program. It makes more sense to me that our employees be able to help pick who their coworkers are going to be. So if we have a nurse that knows of a nurse in another community that thinks that would be a great person to join our team, wouldn't it make more sense to pay them a little bit of money to refer the program rather than to pay a recruiter? So I'm going to be making that proposal to the board at the October meeting. Moving on to medical staff, there are a number of contracts with the medical staff that I'll be working on, and I gave the board a quick summary. I plan to be working with Dr. Burnett and the medical staff looking at the schedules of our medical staff. Now that we have an emergency department, 24/7 emergency department, we can look especially at our same day or urgent care clinics, and we can look at those schedules and how they might best be adjusted. And just an aside, I've heard a couple of comments about the folks in Big Piney and Marbleton being worried about the program down there. Believe me, there is no talk. No one has said anything about changing, specifically closing those programs. So check that one off the list. It's not something you need to worry about. Part of our mission is serving the Big Piney and the Marbleton communities. We're not going to change that. Volumes. I need to understand clearly the reports that the medical staff currently uses to track their volumes. How many patients do they see a day? How many new appointments? How many no-shows? So I'm going to be working again with Dr. Burnett and the medical staff to revise and update the reporting mechanisms that we have. We're looking at purchasing a new ultrasound machine. One of the ones that we had in one of the clinics died. It's important that the doctors in the clinics have access to an ultrasound machine. So we hope to have a proposal that we can take to the board in October to purchase a new one. Moving on to finance. We updated our contract with Press Ganey. Press Ganey is the external company that we use to track patient satisfaction. So just wanted to update the board on that change. It's my understanding that the process was already in place or already started to cancel our what I call an Ask a Nurse program, a phone service where you call in and you can get medical advice from this 1-800 number. Now that we have a 24/7 ED, a service like that is no longer needed. So we're working to save a little bit of money and cancel that service. We're working to make sure that our billing is rock solid. I mentioned earlier how important it is that we be able to go back and do the catch up. And so in preparation for that, we're going to be working with the billing team, the coding team, to make sure that all of our processes are in place. By the end of October, I'm going to have recommendations to the board about how we can assure that our cash flow is sufficient moving forward. I want to talk about additional aspects of construction, and I know that sounds crazy, having just completed a process, but there were a number of topics that were value engineered. I love that term. It's just politically correct code for saying cutting money. We cut money out of the project, and so there are elements that need to be looked at. For example, we shelled in the operating room, but we don't have an operating room. We really should. We should be able to do colonoscopes here. We should be able to do outpatient surgical procedures. That's going to take some planning. So I want the board to sort of shift into the next gear and let's start talking about other space that we need here in our new building, as well as how can we reconfigure spaces that will be vacant. So our sublet center, as we move our residents from that campus up to this one, we're going to have a lot of space down there. How do we use that? How do we reconfigure that? What does that look like? So I made the suggestion to the board that we need to do a facility master plan, and we also need to do a strategic plan, a 3 to 5 year strategic plan. And then the foundation, I want to continue to work with them. They have been such an important partner in making the current project a reality. I want to have a process though where every year we can tell them these are our needs and this is how we would like to prioritize it. And then also have a mechanism where if we have an emergent need, like the ultrasound machine that I mentioned earlier, that we can work with the foundation to get some funding. And then I already talked about the Health Transformation Act. Miscellaneous, so the sublet center move, I already mentioned we're going to be delaying that. We'll announce the date as soon as we know that our residents are feeling up to it. Some people may see our license as they come into the building and that it expires at the end of September. That is a temporary license until we get the CMS number. We already have received a renewal from the state of that license through the end of the calendar year. The state has been wonderful to work with. They really have been able to eliminate a lot of the normal bureaucratic steps that hospitals struggle with as they work to open a brand new hospital. And then the last thing I want to talk about is I want to start to meet people in the community. So I am going to be asking the board, the medical staff, our leadership team, who I need to meet with. So I'll be meeting with key members of the medical staff, all of the leadership team over the next few weeks. But I want to get outside of the building. At the open house yesterday, I talked with a couple of county commissioners about coming down and having regular updates to the county commission. I want to do the same thing for city council. I want to meet with the school superintendent. I want to meet with the sheriff, with the fire chief. If there are other people that I should be meeting with, call me. I will be very interested in hearing your input on how I can make sure that I'm properly plugged into this community so that I can understand how we can better meet the needs of the local healthcare community. And then finally, again, to remind you, this one is a little bit longer, but after every board meeting, I will be doing an update like this. It'll be posted on our website, and it will also be on YouTube so that anyone will be able to watch it and you'll be able to know what's going on. And then if you have any question, Don't hesitate to give me a call. I welcome the opportunity to explain further, or if there's something you're wondering about that I didn't cover today, don't hesitate. Give me a call. Again, I'm Bill Patten. I'm the interim CEO at Sublette County Health, and I look forward to working with you to meet the healthcare needs of our community. Thank you very much.